Procalcitonin is a biomarker that's used to help determine the duration of antibiotic therapy. However, its utility has come into question lately as concerns about antibiotic overuse and antibacterial resistance are in the ascendant. So, what do community physicians need to know? We asked Dr. Richard Wundering, who is a faculty member of the American College of Chest Physicians.
There are several randomized controlled trials of this biomarker that have been done that suggest that you can avoid antibiotic therapy if you have a low procalcitonin level. The procalcitonin is a biomarker that is elevated in response to bacterial infections. It is suppressed by viral infections. So you have this nice discriminating value when you're looking at infections that are possibly viral, possibly bacterial. It's also elevated when you have release of other cytokines, which is where it sometimes falls into some problems of being elevated in patients who may no longer have an infection. So the best data suggests that it may be beneficial in community-acquired pneumonia or in acute exacerbations of COPD. In that setting, several studies have shown that you can avoid antibiotics if you base therapy on procalcitonin. The problem with that is that some of the atypical bacterial infections can actually have low procalcitonin. In one of our studies, a quarter of patients with Legionella pneumonia had low procalcitonin levels at the level that would be suggested to not treat with antibiotics. Mycoplasma and chlamydia, about half of those have low procalcitonin levels. So it may have some benefit in saying if it's low, then you don't need the very aggressive beta-lactam treatment. The other place that it's of great benefit is in places where there's diagnostic uncertainty. Probably the best example of that is congestive heart failure, where there's actually a couple of studies that show if you treat patients who have low procalcitonin levels with antibiotics, that there's actually worse outcome, including worse mortality. Conversely, if you don't treat patients with elevated procalcitonins, that there's worse outcome as well. And this is one of the biggest issues where there's diagnostic confusion. We're not helped by our radiologists. They'll say, looks like pulmonary edema, can't rule out pneumonia. And so this is a situation where procalcitonin may be helpful. A lot of the European studies that use this try to avoid antibiotics from the very beginning. I think that's probably going to be very difficult in the US system, but what it will allow you to do is after that first dose or two in the emergency department, when the procalcitonin comes back, then you can either stop or modify antibiotic therapy based on the procalcitonin level. Procalcitonin also changes in response to treatment. So you can use procalcitonin to follow response to antibiotics. It suggests that you have appropriate antibiotics. Unfortunately, at some point in very severe infections, say sepsis or bacteremic pneumococcal pneumonia, the level plateaus and is no longer decreasing despite the bacteria clearly being gone, and we think that is the fact that these cytokines raise the procalcitonin level as well, and so it's really a marker of ongoing inflammation rather than ongoing infection. So I think procalcitonin has a role in managing patients with infections, particularly respiratory tract infections, particularly milder infections where you might actually stop antibiotics or change the antibiotic regimen based on the procalcitonin level. And really in these ones where there's diagnostic confusion, such as congestive heart failure.